بتكلم عن تخصص الراديولوجي والأشعة. لها أكثر من اسم: medical imaging, radio diagnosis, radiology. It has been changed over the course of the history of the specialty. It basically involves visualizing the internal organs of the body using different modalities, from ionizing radiation to non-ionizing radiation like MR and ultrasound. So what's the job of a radiologist? Radiologist basically looks at the images provided to him and looks at the history provided by the physician, and creates a report based on what he sees and and the amount of information is provided to help provide a reasonable differential diagnosis to the referring physician. Now, let's go through the table of content provided by you guys. So, specialty lifestyle. Can you go to the next slide, please? So, one of the drawbacks of radiology is, if you compare it to surgeons or internists, what they have OR 1 day a week, most of them, and a clinic 1 day a week, then 3 days they just do rounds, pass by the patients. Radiologists, they have, you can say, if you read out sessions, which are like clinics, 5 days a week, so 10 sessions per week. So it's as a consultant, it's a relatively heavy workload, but it's relaxed. You're not in contact with patients directly. You're in contact with a computer, a PAC station, images. It can be boring to some people, so it's not for everyone. You have to try it for a while. If you're a tech-savvy guy, you probably will like it. Minimal patient contact may be beneficial to some people and may not be to others. Other people, many people, they want patient contact, and they want to have clinics and OR and have physical contact with patients. Most radiologists choose this specialty because they want less contact with the patient. On calls, if you're talking about on calls, it depends if you're a trainee, like a resident or a fellow, or if you're a consultant. Usually trainees have very heavy workloads. In most hospitals, at least in the major cities, we're talking about at least in Riyadh, they don't have time to sleep. They do 20 to 30 cases a night from after working hours to the next day. We do have post calls off in the Saudi board, but it's still very heavy workload. Usually with the large number of residents in the program, we don't have frequent calls. At least in Riyadh, it's 1 in 10 days or 15 days. So 2 to 3 calls per month. In my days, it used to be 5 to 7 calls. The number of residents were less, but now we have much more higher number of residents. If you are a consultant on the diagnostic side, like in abdominal radiology or neuroradiology, you can do your calls from home. You can have access to the images from home, and you can change the report and modify the report from home. So relatively easier calls. You seldom get called for a consultation or anything. Most of the time, the juniors do the job for you. You just make sure they don't make major mistakes. So as a consultant, it's really relatively laid back on calls. Let's go back to the previous slide, please. Some subspecialties in radiology, like interventional radiology or neurointervention, their calls are similar to surgery. So they do have heavy workload. They are called in the evenings or late at night for bleeders, for collections, for critical patients. One of the drawbacks of radiology also, or maybe benefits, is it's continuously changing. It's technology dependent. So you need to be updated with the new modalities, new guidelines. You need to be aware of your customers, what they want. By customers, I mean the clinicians. Do they want to go by these guidelines, this staging algorithm or that staging algorithm? So you need to know what they want, and you have to update yourself. So next slide. So work environment. So in terms of on-calls, I spoke about that in the previous slide, the mental and physical stress. During residency, it's acceptable. It's not that much. It's not that much stressful, but you do need to read a lot. So you need to get exposed to more cases. Radiology training is similar to surgery or other subspecialties, where the more you see, the more you know, or the more you get, or the more skills you get. So more cases means more exposure, more patients, better training. So in terms of reading and teaching, it's very stressful. But in terms of patient contact, critical care, and so forth, is not that stressful. It gets less stressful as you get more senior, especially when you reach consultant level. On-calls, as I mentioned, can be heavy during training, but they're not that frequent for the time being. But they are one of the best learning opportunities. You see cases during your calls you may not see during your daily work, especially critical cases, trauma patients. Most of the time in imaging, what you get requests, the patient is already diagnosed, colon cancer for staging, or cirrhosis to rule out hepatocellular carcinoma. But in on-calls, the patient comes with abdominal mass for assessment, or abdominal distension or abdominal pain, and you need to look at the images carefully and entertain different differential diagnosis based on what you see and what clinical information you get. Senior on-calls can be done remotely with the benefit of teleradiology. You can have your station or PC at home and look at the images from home, provide whatever consultation you need from home in your pajamas. So that's one of the major benefits of radiology. Minimal patient contact. It depends on your personality, if you like to have patient contact or you want to avoid that. Most of your contact is with physicians, which is, I think, is quite beneficial, where you're dealing with educated people, the same field, they understand the limitations that you have, and you can discuss the case with someone with the same intellect. Next slide, please. So advantages and disadvantages. So the advantages include relatively rare subspecialty. So we're not just talking locally, it's also internationally. Radiology is a rare subspecialty. It's highly in demand. No patients come to the hospital without needing, rarely you have patients not needing at least an X-ray or a plain film, just like labs. So the demand on radiologists is getting more and more, because we are getting more sensitive and more specific in the diagnosis, and we are becoming more and more helpful with advances in technology. So there's increased demand, and you'll probably, if you go through this field, you'll probably find a job, maybe not in the major cities there, because they are relatively saturated, but especially if you're a general radiologist, but at least you can get a decent position nearby. One of the advantages is you can work remotely. So if you don't find a job in the same city, you can have access to teleradiology service, and you can work from home, cover patients in the same country or even other countries. Most subspecialties are not stressful, excluding, of course, I think intervention, in my opinion, is probably very stressful, because most of the patients you receive are, or many of the patients you receive are sick, unstable, and you need to help manage them. Minimal patient contact, that can be an advantage or disadvantage based on your point of view. And it's technology dependent. That again can be an advantage or disadvantage based on your based on how you look at it. So it can be an advantage where it helps you get better quality images by better machines and better computer systems. You can use artificial intelligence and deep learning to help you reach a better diagnosis and be more accurate in your approach. The disadvantage this may play is people are afraid that artificial intelligence may replace radiologists in the future, and you just need to put the images on in a software, and from the other side, we'll get a report without having any human interference. So this is probably not going to happen in the near future. We do use AI to make our works run smoothly. For example, in the emergency department setting, you can, when you have 200 or 300 X-rays, you can use artificial intelligence to put the images that are probably more critical on the top. For example, the software looks at the images and thinks there might be a fracture, or there might be a pneumothorax, or there might be bowel obstruction. So it puts these X-rays on the top. Or if you're doing 20 to 30 CT brains, one of the artificial intelligence software thinks that this CT brain has an infarction, or that one has bleeding. So it puts these CTs on the top of your reading list, so you can read them before the others. So, but until now, we haven't reached the level where artificial intelligence creates or generates a complete report without a radiologist overlooking the report. So some of the disadvantages that we have in radiology is the relatively heavy workload, 5 days a week. So you basically you can look at it like having 10 clinics every week. So 2 clinics, 1 in the morning, 1 in the afternoon, every week. So that's just like pathology. So we don't have days where there's less workload than the other days. Every day is a heavy workload, which can be beneficial, especially in terms of income, because in many institutes, they pay the radiologist by the number of cases they do. So you do more cases, you get more pay. Or you may have at least a minimum number. If you get higher than that minimum number, then you get paid overtime. So that can be beneficial, having more workload, but it's not for everyone. Heavy competition for training posts. Currently, probably this is also applicable for most other subspecialties, but people applying for radiology now have higher and higher GPAs compared to the days where I was joining. Even the days before me, people with lower GPAs used to go to radiology because they feel that they are probably easier to stay away from patients and work with images and do simple procedures and stay and probably an easier lifestyle. But this is not true. Radiologists need to read a lot in most subspecialties. You need to read in medicine, in pediatrics, in neurology, neurosurgery. You need to read a lot in obstetrics and gynecology, because you're basically looking at the entire body from head to toe. So you need to know different pathologies. How do they manifest on imaging? And at least know the basics of management, so you can provide the clinician with information that he needs to help him manage that patient. For example, if you know that the different ways of management of appendicitis, with surgery, is it putting a surgical drain or not? You need to tell them what they need to know to help them decide. Should I open? Should I send the patient to an interventional radiologist? Should I do further imaging, and so forth? So it does involve a lot and a lot of reading in almost all subspecialties. Next slide, please. So needs and opportunities. So the specialty of radiology is still in high demand. In certain subspecialties more than others. For example, I believe interventional radiology is still in high demand. Neuroradiology, maybe musculoskeletal radiology, probably is saturated in the major cities. But if you have a very good reputation, you're very highly trained, you might succeed this competition. So that's why I recommend for every trainee I meet, it's not as easy as before. The market is now looking for higher qualified. If you want to work in a high caliber hospital and get reasonably good pay, you need to stand out from the others. You need to read more, report more, study more, spend every hour of the working day reading or reviewing and asking questions. Larger cities are relatively saturated, especially in Riyadh. Probably the capital is. If you graduate as a new radiologist today, it might be very difficult to find a post in Riyadh. Teleradiology enables access to more positions locally and internationally. Now, teleradiology has been available worldwide for a long time now, and it has entered the Saudi market for a few years now, and it's been used in the Ministry of Health and the virtual hospital. It's been used in King Faisal Specialist Hospital as well. There are a few other services in the east and the western part of the country, but it hasn't really evolved yet. It's evolving, it's getting more. So that's probably promising, where you don't have to live in Jeddah to work for a teleradiology service based in Jeddah. You can stay in Riyadh, you can have your workstation and access their service from home. So probably that should help get better job opportunities in the future. Major subspecialties in the field include, of course, my favorite subspecialty, abdominal imaging, my subspecialty, cardiothoracic imaging in women imaging, mainly including breast, molecular imaging, which is the new name for nuclear medicine, pediatric radiology, musculoskeletal radiology, neuroradiology, interventional radiology. Now, interventional radiology also includes pediatric intervention, neurointervention. Some interventions are included with the diagnostic side. For example, musculoskeletal radiologists do their diagnostic and interventional procedures themselves. Breast radiologists also do their diagnostic and interventional procedures themselves. Some of them are radiologists do some the diagnostic imaging like CTs and ultrasound and MRs, in addition to doing some basic interventional procedures like drainages and ultrasound guided biopsies. Now, can you go back to the previous slide, please? Okay. Teleradiology. Okay. Next slide, please. Yeah. So how to increase the chance of acceptance? Like any other specialty, try to get in touch with the radiologist and the institute that you're planning to apply for. Try to target the radiologists with influences in acceptance, like program directors or people who work in the Saudi Council. Try to introduce yourself in advance and tell them that you're interested in the field. Get as many recommendations as you can. I prefer, and most radiologists prefer, that an intern or a trainee contacts me at the beginning of the rotation, telling me their interest and their intention of obtaining a recommendation from me, because that allows me to evaluate their level and see if they're worth a recommendation or not. And most people have different levels of recommendation. The mediocre one, which basically states that you worked with them and that's it, and the higher level ones, where they say that they highly recommend you, they support you, and anyone can contact you if they want any reference for your benefit. And also there's a spectrum in between. So introducing yourself, coming to me prepared, reading about the cases we're going to discuss. If, for example, you are discussing a case of cirrhosis, you read about the subspecialty before, or a case of ovarian cyst, you read about ovarian cyst before coming to the readout sessions. And so when you're asked, you know how to answer. Try to read at least some of the small books of imaging. I know that exposure to radiology is not that strong in medical schools, but you can read at least some of the smaller books like Lecture Notes, Radiology, or Diagnostic Imaging by Peter Armstrong before starting your rotation in medical imaging. I myself, if I know that a certain intern intends on taking a